Hello, I'm Dr. Ira Nash. Welcome to Well Said. In high-pressure moments, whether in the operating room or in everyday life, some people seem to move with focus, calm, and purpose, no matter what's happening around them. Neurosurgeon John Boockvar calls this Grit-flowness, a state of mind that allows someone to perform at their best even under stress. It's a mindset that has application beyond medicine, and today we're exploring what Grit-flowness really means, how it's developed, and how we can all bring a little bit more of it to our own lives. To help us unpack this powerful idea and show how it works in real life, we're joined by Dr. Boockvar himself. Some of you may already be familiar with Dr. Boockvar, as he has appeared in the hit Netflix series Lenox Hill and Emergency NYC. Off-screen, he's the vice chair of the Department of Neurosurgery at Lenox Hill Hospital. He's also an investigator in the Laboratory for Brain Tumor Biology at the Feinstein Institutes for Medical Research and a professor of neurosurgery at the Donald and Barbara Zucker School of Medicine at Hofstra Northwell. John, welcome to Well Said.
Thank you for having me, Ira.
So before we get into the subject of Grit-flowness, I'd like to talk first about you and your career, because I think it helps, well, it certainly helps me, hopefully it'll help our listeners, to understand the origin story of the concept. So tell us a little bit about your day job and how you got there.
Well, as you mentioned, I am vice chair of neurosurgery. I'm predominantly a brain tumor specialist, so I deal with cancers and benign growths of the human brain. And so any stress-reducing technique obviously will be helpful to me, as it is a high-pressure environment. But how did I get here? I think the most important influence was my family, and my father in particular, who was a physician here on Long Island at what is now Long Island Jewish Valley Stream. And having that influence in your life as a young, interestingly, I'm an identical twin.
Oh,
and so there's a bit of nature and nurture. My brother went into law school, and I went to medical school. So my father clearly did not overtly try to convert us into doctors, but I surely felt his influence at a young age. And then when I got to Penn as an undergraduate, I started studying neuroanatomy, and when I went to downstate for medical school, I continued to study neuroanatomy. And I'll never forget when I told my father, who was an ophthalmologist, that I was going to go into neurosurgery. You know, his jaw dropped and said, "Don't you want a family? Don't you want to have free time?"
Okay, so for our listeners who may not get the connection there, neurosurgery has a notoriously difficult training pathway that takes years and years and years. And
That's right.
As you started to imply, it's a fairly high-stress environment clinically, and so people find it hard to strike that balance between their personal lives and their professional lives.
Yeah, and I sought to always have, and people always call it work-life balance. I like to say it's life-work balance, and the tipping of the scale is toward your life. And so when I was a third-year medical student, telling my father, who had a great life-work balance as a community ophthalmologist, he was obviously very concerned that as a neurosurgeon I would sacrifice.
Yeah. And so how did that play out?
Well, fortunately, I've made it a priority in my life. I've been married for 26 years. I have 4 children. I have made my life balance very, very good, despite an arduous schedule, and with efficiencies and stress-reducing principles that include grit, flow, and mindfulness, which we'll get into. It's allowed me to get home and be with my kids.
Yeah, I mean, just on a personal note, you and I live in the same community. I sometimes see you on the train platform at hours that are atypical for a neurosurgeon, or at least what I would think to be atypical for a neurosurgeon.
As you know, as a doctor, we can be in the hospital 27 hours a day. There's always enough work for us to do. And then you're invited to a recruitment dinner or some sort of event, you have to be able to say no. And then you have to get home to your spouse and loved ones.
So is that what brought you to a deliberate mindfulness practice?
Absolutely.
And so I guess the question is, was it a mindful decision to pursue mindfulness, or did you just sort of fall into it as, gee, this would be a good pathway to achieve the goals that I want to achieve?
Well, fortunately, my undergraduate major was what was called biological basis of behavior. So I had this underpinning of core psychology and psychopharmacology training. And so at an early age, when nobody was talking about it, and trust me, during my neurosurgery training, nobody cared. I
can imagine that you got some pretty oddball looks about this.
Yeah, I mean, we never talked about our stress, and you took it home and dealt with it. that really allowed me to understand. And then it was actually a patient of mine who brought me a book called Full Catastrophe Living. He was a psychologist. And that basically changed my life.
Well, say more about that book.
So if there's any takeaway from this podcast, it's I would run out and get Full Catastrophe Living by Jon Kabat-Zinn. And Full Catastrophe Living, he calls the full catastrophe your life, your work, your spouse, your loved ones, your family, all the stresses is our full catastrophe. And so how do you live with that? It started at I think it's the University of Massachusetts pain clinic in the late 70s. How to handle pain, how to handle terminal illness. They integrated mindfulness, yoga, and did a bunch of really powerful studies that showed really the efficacy in a scientific way of why this stuff matters.
And when you say this stuff, you're talking about what exactly?
Stress-reducing techniques, including mindfulness.
For those of our listeners who may not be tuned into this, how do you define mindfulness?
So really the best way to define mindfulness, in my opinion, and everyone has a little bit of their own definition, is really being in the present moment and being able to get rid and let go. I like to say see it and let it go. See it and let it go. So when a thought comes into my mind, my mortgage payment, my last patient, you see it, you recognize it, and then you let it go. And that persistence. Now, some people will say that's impossible. We're always being, especially with our smartphones, Instagram and TikTok, we're just getting
bombarded
images of terrible things day and night. Centering yourself on your breathing, I like to say there are 3 things you take with you every day: your wallet, your cell phone, and your breath. If you can actually use your breath as a path to sort of center yourself. By the way, just by focusing on your breathing for 2 minutes cools down your amygdala. Now, your amygdala is an almond-shaped organ in the brain that deals with anxiety and stress. And so studies have shown by simple breathing for as little as 2 minutes, you're doing your brain a favor.
Yeah. So you've sort of built on this and developed your own kind of, I guess, flavor of mindfulness practice. Tell us what that is.
As a neurosurgeon, I knew we all have grit, right? We've talked about how anybody who's in college or in medical school, of course, they're going to have some element of grit. But Angela Duckworth wrote a book called Grit, also a book that I would urge everyone to read. And she talks about the difference between 2 tennis partners that go out every Saturday and play doubles tennis. They're going to have this arrested development where they're going to be great, but they'll never be peak performers. And in neurosurgery and in a lot of things, we talk about peak performance. And so I knew that in order to be a peak performer, you had to have deliberate practice. You had to get into the anatomy lab in residency. I had to get mentors that provided feedback. And that's the difference between someone that arrests in their development and someone that really gets to peak performance.
So continuing to push yourself to get better.
Correct. And now Malcolm Gladwell will say it's 10,000 hours, but it's really not. It could be 8,000 hours. And the biggest thing, and this comes back to my father, is mentorship. So when you talk about Mozart, everyone said, oh, he had perfect pitch. He was a prodigy. But I think his father was a middle school band teacher. And Steph Curry obviously had Del Curry. There are influences that are really important. And that feedback from a very young age, Tiger Woods, whoever it is, many of the athletes that you and I know who have changed the game have had that sort of deliberate practice where they're getting the feedback that they need. And fortunately, that grit leads to something called mental representations, and mental representations allow you to make decisions faster and to stay. Michael Jordan used to say, what do you think about when you shoot the ball? He said, nothing.
I'm not thinking at all. Right.
And he would be able to see the ball go through the net before he even shot. And mental representations form a big part of neurosurgical acumen and success and training. And so that sort of deliberate practice leads to mental representations that lead to good muscle memory and, of course, get us into the flow state.
Yeah. So what is flow?
So flow is the ultimate culmination of that practice where you develop the mental representations and everything is effortless. That's the ultimate flow. Now, you may be a runner, and these are examples of things that if you're not in medicine, you may be running the marathon on Saturday. And we all know that moment where there's music on the radio and the window's down and your hair is blowing in the wind, and that's your flow state. Many different societies have termed it differently. And actually, that's a book called Flow. That's sort of the third of the 3 books that I would recommend by Mihaly, and his last name is too long for me to know, but 1990, great book. And he describes where your training and your muscle memory lead to this flow state where things are effortless and successful. And particularly as a surgeon, that's important.
So you've reached this sort of state of mastery in whatever you're doing in such a way that you're doing it really without a conscious and therefore kind of effortful.
Yes, and what that allows you to do is kind of get rid of the noise. So do you know how many digits of pi are memorized? Do you know what the world record is?
Thousands. I don't.
Do you know how many thousands?
I don't.
You want to guess?
No, I don't.
Well, it's gone up
Yeah.
every year, essentially. So somebody knows by memory 70,000 digits.
70,000?
70,000. Now, that may have changed since.
Okay, maybe it's 75 now. Right.
It takes him 17 hours
Oh, my God.
to recite 70,000. Now, how did he do that?
Yeah.
That is a peak performer, right? And
One would hope that someone would apply that to something of greater
there's a
benefit to
whole host of
humanity, but
scientific
yes.
training, but we see this in field goal kicking now, where people are routinely kicking 70-yard field goals. The art of training is getting better with technology.
Yeah.
But again, for me as a surgeon, as a parent, you can be a concert cellist, you can be a card player, you can do whatever. Being in the flow state is also great for your brain. So a lot of this is understanding what the functional capabilities of the brain are. So when you're in flow, your default mode network, which is basically the ruminating, scrolling on your cell phone part of your brain that is bad, just shuts off. So the more you're in the flow, your less DMN is activated. You're just going to be better off.
So
less
you
anxiety.
feel better and you're better at what you're doing.
Correct.
Yeah. I want to go back to the grit part of this because you describe it, if I was hearing you correctly, as this sort of continuous improvement in technical proficiency. When I hear the word grit, I also tend to associate that with kind of overcoming resistance. It's the persistence part of it that, you get pushed back, but you get back up. How does that relate to this?
Well, I think you're right. I think a question I used to always ask my kids are, what's more important, talent or effort? Just to make sure, effort is basically twice as important as talent, right? And so what you're saying about getting back up does involve this effort to really put in the hours and put in the time and miss the things that you may have to miss. I don't know if you remember Andre Agassi, the famous tennis player. He hated tennis.
Yeah.
And many tennis players do, but he put in the time to be a peak performer. It's not always pleasant, but you need to pick your interest early. And I always like to say, you're good at what you like and you like what you're good at, right? So think about what you like. You'll probably be good at it. You'll probably want to put in the effort.
Yeah. How long did it take you to kind of put these concepts together? How did you put these concepts together?
I don't really remember. It's a terrible term, but here's what I knew. When I was sitting under the microscope in times of stress.
When you say sitting under the microscope?
I was doing surgery on the brain.
Okay, so you're using a microscope to actually operate in very tight quarters.
In very tight
head.
quarters.
Yeah.
There were times when, as a surgeon, I have to be able to handle catastrophe, whether an aneurysm ruptures or something, the heart stops, whatever it is. Something bad. And so what all of us do is catastrophize, right? You're like, oh gosh, if I don't get this bleeding stopped and the patient dies, and then I'm not going to get another referral from that doctor, and my wife's going to leave me because I don't have a job, and like you go down this rabbit hole. That's like the worst thing you do. So I sought to make sure that I would never activate my default mode network in surgery.
So this was a very deliberate,
yes, and it takes
conscious
practice
effort on your part.
I started breathing exercises, started mindfulness training, started yoga routinely, and I started to understand the value of my training. And I still, to this day, my wife always says, don't you know how to do this? Why are you reading the night before? And I remind her that I'm reading to form mental representations, to develop the muscle memory, to make sure I'm in the flow state when I'm in surgery.
Yeah. So how do you actually apply this in your clinical practice? So take us through a typical day in your surgical practice where this comes in handy.
Well, let me just tell you when I find time. So I take the subway from Harlem to 86th Street. It's a 6-minute subway. Right. It's very busy. And that's actually when I breathe for the first time of the day.
Breathe in this special way.
Yeah. Basically, it's like smell the roses, blow out the candles.
Yeah.
Smell the roses, blow out the candles.
Hard to do on the 4 train.
It's very hard to do on any train, but it is a time where I know every day is the exact same time. I know it's 6 minutes long, and I know it's going to help me.
Okay.
The other thing we can do is something called the 4-7-8 breath, which is even harder. It's 4 seconds on the inhale, 7 seconds holding at the top, and a nice long 8-second exhale. That's like the correct breathing of a mindfulness breath. We do something called a mindful moment before every surgery. So you know that there's something called the surgical timeout. It's a checklist, almost like the cockpit does before we take off.
And that involves you and the other members of the surgical team?
Anesthesia, surgical tech, circulating nurse, residents, fellows, whomever. We go through side of the operation, consent form, date of birth, you name it.
Make sure you're doing the right thing on the right patient.
Exactly.
Yeah, okay.
At the end of that, we pause, and I introduce something called the mindful moment, which is I stop the entire room where the only sound in the room is the heart beating of the monitor, and we go through a very brief breathing exercise. Everybody in the room. And there's always somebody new because we have so many students and fellows and whatnot. And they all walk away with the same, like, amazed feeling that, wow, someone's actually bringing attention to this.
Yeah. I know a lot of your patients are actually awake during surgery. Are the patients participating in this too?
Not at this point.
Okay.
Because even in awake surgery, I put the patient to sleep for the first part of the operation because that can be painful.
Okay.
But I have had many patients. You mentioned the Netflix show. They did show an episode where I was doing a mindful moment. So a lot of patients come in and say, I'm grateful that you take a moment to do that.
Yeah. Yeah. So they have a sense that you are more focused on their needs at that moment.
And not, surgeons have a reputation for being selfish and
Really?
Arrogant. So to take a moment and make sure your circulator, I mean, we're also like a family, right? So we're making sure that everybody is heard in a way.
Well, you sort of anticipated a question I had, which was, to what extent do you discuss this with your patients beforehand? You mentioned that some patients actually bring it to you, but for somebody who doesn't know you from Netflix, is this something you discuss with them preoperatively?
Not really, unless it comes up. A lot of patients, interestingly, say, "Doc, show me your hands."
They want to
make sure you're steady. I mean, they do
Really?
all sorts of crazy things, but the best is show me your hands.
Yeah.
Or shake my hand. I want to make sure your hands are not sweaty. Things like that. That would be a moment where I would bring something like that up.
Okay. And so you've obviously stuck with this. So I'm assuming you feel like it's been valuable in your clinical practice. How would you describe the impact that it's had on you personally and professionally?
Well, if you look at the data, and again, I'm a perfectionist when it comes to outcome. If you look at the data of error rates, there was a big Japanese study that looked at railroad conductor errors. After they started mindfulness training, error rates dropped like 88%. They looked at University of Miami football players, and they randomized them to standard stress reduction techniques and mindfulness, and their focus and attention was better. I like to think that this has had a meaningful impact on my low mortality and morbidity percentages.
So you
thank
think
goodness.
this is part of your success as a neurosurgeon?
I think it absolutely is. I'm 20 years into my career, almost, I would say, halfway done. It has really grounded me and provided a very good foundation for how I handle stress, and I think it's improved my outcomes.
Are you an evangelist for this?
To those who, I don't go out and, preach to the world, but I'll go to conferences of nurses and they want to hear about it. Yeah. And I think our medical schools have obviously, you and me did not get taught mindfulness in medical school.
Not at all.
But they are bringing it into every Fortune 500 company, the military. And if you look at the data, it's striking what happens in the brain.
Yeah, I'm struck by the fact that you're at an interesting intersection of working on the brain and working on your own brain while you're working on somebody else's brain.
Well, it allows me to understand the science so well. And we have people in our department Randy D'Amico, for example, who's studying this new technology called connectomics, which is we can now look at pathways, interconnected pathways between the default mode network and salience networks and resting states and awake states. So the ability to understand really what's happening is going to help us. And you and I know that in this age of social media, of rumination, of scrolling, it is just... It is going to have
the antidote for that. How would you say your professional colleagues have reacted to this? I can imagine, I mean, we were joking before about neurosurgery being a pretty stoic historically and kind of high stress, hierarchical kind of environment. I can imagine this was met with a fair amount of skepticism, if not outright derision.
Yeah, really, it depends upon the person. But David Langer, who's my partner, good friend, he has taken my mindful moment and made it into his mindful moment.
Okay.
So what David likes to do, he likes to tell a little story about each patient. So he had never stopped to have a moment after the surgical timeout. But now his mindful moment is he to ask the patient, we're going to have this mindful moment and tell a story. You're a school teacher, you're a parent, you have a dog named Lucy, whatever it is, to center the whole group around it. So he's taken it and run with it.
Yeah, I've heard other surgeons read a letter from a family member about the patient, just to kind of personalize the effort that the team is making on behalf of the patient in the operating room. I want to take this away from medicine for a little bit, because you mentioned industry is using this, studies in other domains. What do you think the application of this is more broadly, and how would you kind of assess that potential?
I think in the current age of our children and the generation that has gone through COVID and has gone through this massive explosion in social media and anxiety and depression as well, we are really going to be forced to help them deal with stress and anxiety. Their amygdalas are basically all inflamed. So just from a global sort of public health phenomena, we're going to be dealing with a generation that's going to need a lot of help. So I think there's value to understanding that. In any other field, you can be a teammate, a teacher, a loved one, a parent. You can be in the bunker with someone fighting a terrible war. If stress is in that moment, to me, when the stress in the moment in the operating room, I know everybody in the room is going to know how to calm down and know how to take a moment and center themselves on their own breathing. And to me, that's a very effective team mentality.
Yeah. How do you think this should be distributed in a sense? What can you see as an effective way of promoting this kind of approach?
I believe in the science. I mean, it took a Harvard Medical School publication to basically convince many, many people of the value of this when John Kabat-Zinn was doing this since the 70s. Yeah. So, you know, in Nepal and India, these things has been part of their practice for thousands of years.
Yeah.
In 2011, a Harvard study of functional imaging of the brain showed what really is happening with a short dose of mindfulness, if you will. And so I think it starts in the medical schools. I think it starts in the elementary schools. I think it starts in our education system. I think it starts obviously on campuses like this. I think it starts in families. I think it's something that should be considered when babies leave the hospital. You know,
teaching parents too.
Teaching parents. We all say, okay, there's obviously suicide hotlines and all these other hotlines. It's really a fundamental thing that everyone should not be afraid to make. You know what happens? You know, I'm a camp doctor over the summer, and I go up to the Adirondacks, and I take care of about 500 people for 2 weeks as a neurosurgeon. You know, I have 4 kids, so I'm basically a pediatrician at this point. But there's so many kids who have just been given Lexapro and Prozac, and they're under 18, and it's just we weren't medicated like they're being medicated.
Yeah.
And so I think it's a big problem. I can tell you, I bought this book for my daughter Daphne, who read it skin to skin in high school, underlying. She still refers to it. I think I've given it to kids at camp who I think have stress and anxiety. It's a thick book, but it's repetitive. You're going to walk away with the same fundamentals. If you read Full Catastrophe Living, you're going to really try to stay off Lexapro.
Yeah. Well, that also kind of anticipated my next question. So for somebody whose curiosity we may have piqued in the last 25 minutes, how would you suggest they get started?
Buy the book.
Buy the book. All right.
I have no financial interest in the book. It just is a book that I think is a life-altering book. And, there are a lot of books out there, right? So everyone's going to say, oh, you buy Peter Attia, you buy this. Yeah. This is a very old book.
Yeah.
It stood the test of time. He's the grandfather of American mindfulness, and he's got no skin in the game. He's just revolutionized so much. It is a really powerful book.
Yeah. And if somebody were interested in learning about this without sort of committing to it, are there sources of information, a compendium of maybe some of the information you've shared, the data that this works? Where can somebody go to get started in making the decision, hey, this is something I really want to pursue?
Well, they can always Google me, frankly, John Boockvar and mindfulness, and they'll see a couple of very brief publications, whether it's Huffington Post or something to sort of read and get started. And in those posts, you'll see some of the recommendations for reading and whatnot. You can put the Calm app on your phone and Mindspace and some other things that I'd rather you not look at your phone, but if you need to get started, those are places to get started. What I don't want people to do, and that's why reading Full Catastrophe Living for me is I just don't want people to sort of throw it away and say, oh, this is hocus pocus. I want them to understand exactly why you're doing what you're doing.
Yeah. What does the future of this look like in your own personal practice?
Yeah, I'm just going to continue doing what I do, and I think that I'm very pleased that I've been able to rein in. I've been a functional high anxiety person for years, and that's great, but it's also good to know that you're at a state that you can calm yourself down and relax and be in the flow state and handle stress and handle the aneurysm rupture and handle your kids' craziness and handle stress and really help yourself get through it.
Yeah. And I think I like where we're wrapping up here, that this is not just applicable to somebody who's, up to his proverbial elbows in somebody's brain. This has broad application in the kind of day-to-day quotidian stresses that we all face.
Probably more so. With levels of addiction and levels of divorce and levels of financial struggles, anybody and everybody needs to handle their anxiety. There's not a person out there who can't benefit from this.
Yeah. Well, John, thank you so much. I think this has been a really interesting conversation. I've learned a lot, and I appreciate your sharing your insights and expertise with us.
Well, thank you, Dr. Nash, for having me.
Okay. Well, my guest today has been Dr. John Boockvar. He is the Vice Chair of the Department of Neurosurgery at Lenox Hill Hospital and a Professor of Neurosurgery at the Zucker School of Medicine. I also want to thank our editor, Ed Lee, our producer, Lois Bentavenia, and our audio engineer, John Mullen. For more information about this particular program and to find all of our past episodes, please visit our website at medicine.hofstra.edu/wellsaid. You can also subscribe to our free podcast wherever you get your podcasts. Our listeners are welcome to send their comments, suggestions, and questions to wellsaid@hofstra.edu. Until next time, I'm Dr. Ira Nash, and that's Well Said.